Hi, welcome to Caregiver Cast. I'm Mary Elaine Petrucci, your host. My guest today is Kevin Ellis, who is known as the Bone Coach, who will be talking to us about osteoporosis. Before I formally introduce Kevin, I would just like to give you some background information about him. Kevin Ellis, better known as Bone Coach, is a certified integrative nutrition health coach, podcaster, YouTuber, bone health advocate, and is the founder of bonecoach.com. After an osteoporosis diagnosis in his early 30s, he realized just how challenging it can be for the average person to make sense of what needs to be done to improve and how to move forward confidently with a stronger bones plan. Today, not only has he transformed his own health and made continued progress on his own journey, he's now dedicated his life to helping women with osteopenia and osteoporosis gain clarity and confidence that improving is possible. Through a unique three-step approach and world-class coaching programs, Kevin and his team of credentialed experts have helped people in over 1,500 cities around the world get confidence in their stronger bones plan. His mission is not to just help over 1+ million people around the globe to build stronger bones. It's to help our children and grandchildren have the education, resources, and nourishment needed to prevent osteoporosis and other diseases in the future, so they can lead long, active lives. Welcome, Kevin, to Caregiver Cast.
Thanks so much for having me, Mary Elaine. It's great to be here.
It's awesome. I've really enjoyed our initial conversation, and tell us how you got started on this journey, helping women with osteopenia and osteoporosis. In fact, how come you were diagnosed with osteoporosis in your early 30s?
Yeah, absolutely. And I could even start with, my own personal health journey started a long time ago, when I was much younger. When my mother was 5 months pregnant with me, my father was told that he had cancer. And 2 months after I was born, he passed away. He was 35.
Goodness.
He was 35. So my entire life, I had this fear that I was going to follow in his footsteps to an early grave and not have the opportunity to be there for my kids and experience the joys of being a father. And when I was diagnosed with osteoporosis at 31, largely due from malabsorption of nutrients from celiac disease, but there were some other reasons for that too. And I was still struggling to resolve all these other health issues. I thought my fate was going to be the same as my father. I had a young daughter, son on the way, and I was scared. And the doctor and the conversations I had surrounding the diagnosis were all about bone drugs and fracture were in my future. And that left a pretty bleak picture for me. And, having young kids and a wife and a family and things like that. And that wasn't going to be enough for me. So I had to start doing some reading and research and consulting with different experts and people and pulling together a plan. And when I was finally able to get on the path to improving my health and improving my bones, I realized along the way that just how challenging it could be for the average person. It's mostly the average woman who's 50, 60, 70 years old, not the average 30-year-old man usually.
Exactly.
To get the right plan in place for their specific needs, because the standard recommendation for most of the people that are diagnosed with osteoporosis is calcium, vitamin D, walking, and a bone drug. And that's woefully inadequate. And it's really for that reason that I started Bone Coach and bonecoach.com.
That's amazing. So can you explain the difference between osteopenia and osteoporosis, and how would you know if you had it?
Yeah, absolutely. So, and osteoporosis literally means porous bone, and it's characterized by either not enough bone formation, excessive bone loss, or it's a combination of the two. And in osteoporosis, both your bone density and your bone quality are reduced, which is going to increase your risk of fracture. And the way you find out you have osteoporosis is through a Dexa scan. That's dual energy X-ray absorptiometry. It's a painless test, kind of like an X-ray, but very low levels of radiation. And you lay down on this machine. The machine does a scan, which tells you your bone mineral density, the actual mineral content of your bone. And then it generates a score. And the score is called a T-score. And a T-score is telling you how much your bone mass differs from the bone mass of an average healthy 30-year-old adult. A score of 0 means your bone density is equal to the norm for that healthy young adult. A score of +1, -1, still considered normal and healthy. A T-score between -1 and -2.5 indicates you have low bone mass, which is oftentimes called osteopenia.
Okay.
Osteopenia is like a precursor to osteoporosis. So a T-score of -2.5 or lower, -2.6, -2.7, so on and so forth, indicates that you have osteoporosis. The greater that negative number is and becomes, the more severe the osteoporosis. Now, most women are going to get these scans done by the time they're in their 50s and 60s as a check in the box. Their doctors will order them, but usually that's too late. We want to have them done much earlier if we haven't already had them done. So if someone is listening to this right now and they haven't had a bone density scan, I would absolutely go get one. So you're not shocked, it's also, if you've seen maybe someone in your life, maybe it's your parent or your mother or somebody. I hear this all the time, especially from the women 50s, 60s that we work with. They talk about their mothers or their parents who maybe fractured a hip or started developing, hunched over posture. And they might not take action because they don't want to know the answer. And I've seen that sometimes, but I would just recommend, get the information. So if there's something that needs to be addressed, we can actually address that.
Excellent. So what causes these two conditions to begin with, and how can we prevent it?
Well, usually what I like to do is I like to use the metaphor of a bucket when we're talking about bone mineral density. So if you imagine you have a bucket of water, right? The bucket represents your body. The water within the bucket represents your bone mineral density, the measure of how much bone you have. And imagine this bucket has a small hole in it with a very tiny leak. And over time, over years and years, that water level gets lower and lower and lower until one day you realize your water is low. You get that bone density scan done, and you realize you have low bone density. You have osteopenia or osteoporosis, and you're shocked. It's either a couple different scenarios. Either somebody is working out, eating healthy, doing all these right things, and they get a Dexa scan as a check in the box, and they find out they have osteoporosis, or they have a bunch of other health issues, and that's what led them to get the Dexa scan. But in either of those two scenarios, you have this visceral reaction of, I have to do something right now. And at that point in time, you're usually having a discussion with your physician where a medication may be proposed. And we always need to pause to make sure we make the most educated and informed decision, because a lot of people don't realize you might not be actively losing bone right now if you were diagnosed with osteoporosis. So what do we have to do? We have to figure out, number one, is there a hole in your bucket right now? Are you still actively losing bone right now today? What's causing that hole or holes? Or did you just not start with a full bucket to begin with? Did you just not build up enough peak bone mass in your younger years? A lot of times it's a combination of the three of those things. So let's talk about the first one. Is there a hole in your bucket? Are you still actively losing bone right now? A single bone density scan is not going to tell you that. Okay. There's one test called the serum CTX test, CT low peptide test. This test measures collagen bone protein fragments. Okay. And if that activity level, if that is really high, that can be an indicator of active bone loss. Okay, so that's one way that we can notice that. So if we're going into our physician, we're just told we have osteoporosis, before we make any decisions, you have to have some objective information. That's the first one. The next one is what caused the hole. Okay, what's contributing or has contributed to your bone loss? Most people don't know this, but there are multiple types of osteoporosis. There's primary osteoporosis, which typically occurs because of the decrease in estrogen that takes place in postmenopausal women. Estrogen has a protective effect on bone. When estrogen levels decrease, as they do during menopause, it causes an increase in the activity level of those cells that are breaking down bone. But then there's a whole nother cause of osteoporosis. That's secondary osteoporosis. That's the category I fell into. And this is where osteoporosis occurs as a result of behaviors, conditions, diseases, disorders, and medications. And if you're unexpectedly diagnosed, a lot of times there is a secondary cause, 30s, 40s, 50s, 60s, and we need to figure out what that cause is. And the last part of that is, was your bucket just not full to begin with? Okay. Again, you might not be actively losing bone right now, but maybe it was something that happened in your childhood, in your younger years. Up to 90% of your bone mass is, acquired by the time you turn 18, and it's going to peak by the time you turn 30. So by the time you turn 30, your bucket is about as full as it's going to be. Now, if when you were younger, you had an eating disorder, poor nutrition, low calcium and vitamin D intake, you smoked or drank excessively, you led a sedentary lifestyle, or you took certain medications, those all could have prevented you from achieving peak bone mass and starting with a full bucket.
That's a lot to think about, Kevin. So I guess my question is, once we hear that we have this diagnosis for osteoporosis, do we ask for that blood test?
Absolutely. You absolutely should ask for that test, especially before jumping right into a decision to take, something like a bone medication, which these bone drugs are not, they're not like taking an aspirin. They have a dramatic effect on bone physiology. So, most of the people that we work with and help, they're trying to do everything they possibly can naturally first before considering that as an option. There are some situations where we work with people that have really low bone density. Maybe they've fractured multiple times. Maybe they're on a medication and they know that's the way that's going to be, moving forward for them. And we still support them in that way. But if you're at that point of diagnosis, there's more objective data you need to have, like some testing, before you actually make that decision to move forward.
Okay, thank you for that, because sometimes I know I just kind of accept like the standard treatment protocol for a disorder like osteoporosis. And you are obviously saying that that is not enough. So besides the other blood test and the Dexa scan, what else do we have to look at?
There are quite a few other things. I mean, in terms of, if you were to break down the overall picture of what you need to focus on, I would say the next place you have to look is, and I actually use another metaphor for this too, which is diet, nutrition, absorption, which is super, super important. So
I agree.
Let's even just talk about that for a second. So healthy bones, they're not going to be built by what you eat. They're built by what you absorb. I know I talked about a bucket for a minute. I use that metaphor, but let's forget about the bucket. If you think of our bodies and our bones as being like plants, in order to grow, they need nutrients and the right conditions, right? Most people focus so much on the nutrients, the salads, the smoothies, the supplements, that they fail to consider the soil. Our gut is like the soil. We absorb almost everything here. So when we take in food or supplements, We start to break them down into smaller pieces in our mouth. That food makes its way into our stomach where it's churned in this acidic mix to break it down even further. Then it makes its way to our small intestine, our soil. And this is where nutrients are broken down to their smallest form to be absorbed by us, the plants. But in order to absorb anything, you need roots in your soil. Our roots are called villi, and they're these tiny hair-like projections that cover our small intestine, and they're responsible for absorbing nutrients. They absorb the nutrients from the food you eat, and then they shuttle those nutrients into your bloodstream so they can travel where they're needed in the body, whether that's healing a cut on your hand, growing your hair or your fingernails, or rebuilding stronger, healthier bones, right? The job of our roots, our villi, is so important that the total surface area they use to absorb nutrients is the size of a football field.
That's amazing.
That, right?
Oh, it's very amazing.
But if you've got poor digestion or your gut health isn't optimal, you're not going to properly break down your food. And if you can't properly break down your food, those nutrients aren't going to be available. And if the nutrients aren't available, the villi, your roots, won't be able to absorb them. And the body's not going to have what it needs to heal itself and rebuild stronger, healthier bones. So that's why you really have to start. That's one of the most important places to start. Are nutrients making it to your soil? If you have bloating, belching, burping, excessive gas, even diarrhea after meals, or you feel like food just sits in your stomach and stagnates for a long time, there's a good chance you have low stomach acid. Age, stress, nutrient deficiencies, gut infections, those are all contributors. And surprisingly, do you know what one of the best indicators of low stomach acid is?
No, go ahead.
Reflux. Shocking, right? When people have reflux, what do they take for? The same thing I took for a number of years: Tums and proton pump inhibitors like Prilosec, Prevacid, Nexium, Omeprazole. Like most people who take PPIs, I mistakenly thought I had too much stomach acid, and I ended up suppressing what little stomach acid I did have. The reason that's a problem is we need stomach acid to properly break down and extract nutrients from our food, like amino acids, the building blocks of protein. Our bones are 50% protein by volume. They need amino acids. Calcium. Calcium is the primary mineral constituent of our bones. Low stomach acid reduces its absorption. Magnesium, iron, B12. If you have low stomach acid, your soil is going to be starved of these nutrients and others too. So that's the first one. There's some other areas with that too, in terms of, gut infections, dysbiosis. Are there bad bugs in your soil? Basically, do you have the wrong balance of bugs, which would be dysbiosis? Do you have the presence of bad bugs, which could be gut infections? Or do you have good bugs in the wrong place? There's something called small intestinal bacterial overgrowth. And when you have these situations going on, when your microbiome is out of balance, it negatively affects your ability to absorb nutrients, and it contributes to leaky gut and systemic inflammation. Both of those are not good for your body, your bones. And all those things I talked about before that people experience: bloating, belching, excessive gas, heartburn, constipation, diarrhea, even fatigue, those can all be indicators of those things.
Okay, so how do we know? That's amazing how I totally agree with you. I know there's been a lot of studies and webinars and conferences about gut health and how it affects your whole entire body. So my question is, though, how do you know if you do have low acid, an infection, or this overgrowth in your small intestine? How would you know that?
Absolutely. So there are multiple tests. There are multiple tests that you can do to find out if you have low stomach acid. Some of them are a little more expensive than others, but you can do some testing. And then also you can use, and obviously I'm not laying out a protocol or anything like that here, but generally speaking, you would work with like a functional medicine practitioner or something. But adding in something like betaine HCl, which is supplemental stomach acid, if that helps those symptoms, that could be one of the things that, one of your root cause issues that needed to be addressed was low stomach acid. And then in terms of some of the other tests, you can do some functional stool testing and things like that to help understand if you have a bad balance of bugs, maybe you have a gut infection or small intestinal bacterial overgrowth. And then there are some other conditions and diseases that can also affect your body's ability to absorb nutrients. So celiac disease, that's what I have. That is one of those conditions, right? And that's celiac disease contributes to malabsorption and bone loss because when you ingest gluten, those villi, those roots, our roots become blunted to the point where they can't do their job, right? So for me, my roots effectively became damaged and my body was being starved of these key nutrients, these bone healthy nutrients like calcium, phosphorus, vitamin D, magnesium. These are usually absorbed a little higher up in the small intestine where that damage is more likely to occur. And this went on for years for me. I had no idea calcium was being raked from my bones, which is a great reserve of minerals, right, to serve other purposes in your body, because your body is going to need these nutrients to execute its daily functions, muscle contractions, nerve impulses, pumping different things throughout your body. You need nutrients to do that. And if you're not getting them, you're not taking them in, your body is going to pull from the reserves that it does have. And a great source of those reserves are in your bones. So for finding out if you have celiac disease, you have to be on a gluten-containing diet for a minimum of 30 days, which is going to make sure you have those antibodies present. And then you would do something called a serum or a TTG IgA test.
Right.
There's also a total serum IgA test, and there are some different antibody tests that you can do also. So those are some helpful tests for that.
Thank you for all that. Yeah, I think a lot of caregivers probably need to check all of those conditions and have all those tests done so they can get to the root cause of osteoporosis. So in your journey, have you found a perfect diet for osteoporosis?
I get asked that question a lot. And, there is a lot of times people hate my answer, right? Because there's no perfect diet for every single person. We're all biochemically, genetically unique individuals. We respond to different foods and supplements, dietary approaches differently. And that's why no dietary approach should be considered a rigid framework with zero flexibility. And it's also why when you hear someone saying everyone should eat this specific superfood, it's guaranteed to be good for your body and your bones, make note of it, but realize also that if it creates inflammation in your body, it's not a health food for you, which is super, super important. And then, I would say in general, there are some foods that I find that work really well with most people and that can really be helpful to support good bone health. Okay, this is not a whole dietary plan, but these are ones that generally speaking, I see work pretty well with a lot of people. The first one would be different types of fish, but fish that have bones in them. Okay, now I know when we hear bone-in fish, we're thinking, wow, these hard, pokey, bones that aren't really appetizing and could potentially hurt us. But if you get things like canned salmon, canned mackerel, canned sardines, and they can have these bones in them that are really super, super soft. They almost kind of melt in your mouth. And they contain all of the nutrients your bones and your body need to become stronger, right? If you get the bones in these fish, they have all the nutrients you need to support healthy bones. And especially when we're talking about fish, if you get some canned salmon or mackerel or sardines or something like that, they're going to contain protein, which is made up of amino acids, which are the building blocks of everything in our body, right? So that's super important. And then omega-3s. It's a healthy fat that it basically can help dampen inflammation in the body, which is a driver of disease also. So that's a good general one. And then also coconut oil. Coconut oil is considered one of the healthiest foods on the planet. It's got over 1,500 studies showing its benefits. Now, beyond just bone health, it's good for energy, weight, brain function, heart health, memory, skin, hair, teeth, gut health, and even bones, right? And there were some studies that looked at bones specifically. Virgin coconut oil was able to not just be helpful in the protection against bone loss, but might actually be helpful in the improvement of bone structure also. Coconut oil does contain polyphenols also, and these are compounds that can help protect the body cells and tissues from damage. So that's super important.
So sorry, coconut oil versus olive oil.
And well, olive oil can also be a beneficial addition. Extra virgin olive oil is going to be the kind that you would look for. But there are a lot of fake olive oils out there in the supermarket too.
Right. That's what I've heard. So how do you tell?
Well, there are some great brands of olive oils that you can get. There's a brand called Casandrinos olive oil. They have an organic extra virgin olive oil that is a great source there. So olive oil can be a substitute too. Avocado oil can also be. But then in terms of coconut oil is also a good one for a few other reasons too. One of the reasons coconut oil is also good is a lot of times people are struggling with digestive issues too. Coconut oil has antimicrobial and antifungal effects because 50% of the fatty acids in coconut oil are what we call lauric acid. And when the body digests lauric acid, it forms a substance called monolaurin. And both lauric acid and monolaurin help fight those bad bugs and pathogens, and even the same bacteria that causes staph infections, C. diff, and the same candida yeast that causes oral thrush. That's one of the reasons coconut oil can be a great addition too. And then greens. A lot of times people want to know about the right greens to eat.
Exactly.
Arugula is an amazing, one of my absolute favorites. It's a leafy green. It's in the same cruciferous family of vegetables as broccoli and kale. It's rich in potassium, folate, vitamin C, vitamin K, and calcium. Calcium obviously is, we're looking to get calcium into our diets. Unlike spinach, a lot of people, you may go to the supermarket and you may turn over a thing of spinach and see that it says it's got a lot of calcium in it. But what a lot of people don't understand is that calcium is bound up with an anti-nutrient or called oxalates. Oxalates are an anti-nutrient that bind up bone healthy minerals like calcium, and it's going to prevent us from absorbing those nutrients. So the calcium in spinach is really not bioavailable. Okay. So if you've got digestive issues, kidney stones, arthritis, joint pain, those may be some indicators that you might have a hard time breaking down and degrading oxalate. So swapping the spinach for the arugula could be a good helpful point too.
Great.
So those are a couple good foods.
Awesome. Can I just go back to the canned tuna and salmon? Do they all, if they're canned and I'm assuming they're processed a little bit to fit in the can, but how do you know if there's bone in it or not?
It'll say it on the label. It'll say it on the label. One of my favorite brands is Vital Choice. Vital Choice has some great ones. And you can find bone-in sardines there, with the bone-in, skin on. They've got plain ones. They've got other different flavors and stuff in there. So, and even, we just recently, a lot of times our clients are like, gosh, I want to eat sardines, but it's hard to eat them. Like they're not something that I would just add into my daily repertoire, every day. So we actually started creating some recipe videos and things like that around how do we make, they're on YouTube right now, but how do you make these things actually taste good when you start including them into your diet? So those are, it'll say bone in on the label too.
And would you find this brand of fish or canned fish in like a health market? Like
you can.
Whole Foods or Vitamin
Yep.
Cottage or something?
Yep, you sure can.
Okay.
You just go in there and all you do is you just ask, hey, do you have sardines with the bones in? And again, they're not hard bones. They're really, really soft.
I'll take your word for it. Okay. So in addition to nutrition, and the connection between our gut health and bone health, where does exercise fit into all of this?
Exercise plays such an important role in our bone health. There are a couple different types of exercise. So the types of stimuli that we need for healthy bones are we need muscle pulling on bone and impact. The most effective interventions for improving your bone health they use either both, one or both in combination. And what happens there is, at least for muscle pulling on bone, muscle is going to pull on bone to make them stronger. You've got this mechanical signal that sends a chemical signal, and that's going to tell your bones that they need to become stronger. And then you have impact exercise too. So even if we were to just break down the types of exercise for bone health, let's start with the one that most everybody always hears about, which is weight-bearing exercise. What does that even mean, right? Weight-bearing exercise is where your bones and your muscles are working against gravity to keep you upright, okay? And they're activities that you're doing on your feet. That's going to place some good stress on your bones. Now, there's high impact and low impact weight-bearing exercise. So the high impact that's your running, your jogging, your hiking, those kinds of things are going to be higher impact. Your lower impact is going to be brisk walking. That's going to be a yoga, a Pilates, a Tai Chi, those kinds of things are going to be the lower impact. Then there are non-weight bearing exercises like cycling, swimming. These kinds of things are, and it's not to say we should never do these things because there could still be some benefits, but you can't count on these things to be your primary forms of exercise because your body is not working against gravity when you're swimming in a pool all the time. Right. So that's super important to keep in mind. Again, not saying we have to be afraid of the pool, but it's just saying that we need other kinds of stimulus for our muscle and our bones. The other stimulus that we want to have is muscle strengthening exercise. Okay. So this is like resistance training. And this is going to involve your muscle, like working your muscles against an opposing force. Well, that's a dumbbell, a resistance band, even your own body weight in some cases. And this would be lifting weights, resistance exercise, sometimes body weight exercise. The most important things here are the intensity of the exercise. The studies that show the greatest effect on improving your bones are in 5 to 10 repetition range.
Okay. That's not very much.
But it's because that's the amount of weight, like you've increased the weight to the point where that's what you can accomplish. And especially when it comes to exercise. I always encourage people, if you don't have a background in exercise, don't just try to jump in and start doing a bunch of random things. We want to take a step-by-step approach, and you want to kind of build it in slowly and progress from there. Super, super important.
Oh, definitely. So I guess we would have to see like a sports person or someone like yourself to know, I mean, like how much weight to start with. I know when I've used like the equipment at the gym, we would start at a really low level and then I could just, increase the weight. So it really, I would agree with you that you have to look at where you're at right now.
Yeah, and because you want to make sure you've got the right body mechanics. You want to make sure that your form is good, especially before you start increasing weight, because the last thing you want to do is increase weight with poor form. That's going to lead to injury. And in the case of osteoporosis, you're setting yourself up for potential fracture and things like that too. So it's good to get a good plan in place and progress slowly up to that.
Great advice. You mentioned fractures now. So is fracture guaranteed just because you have low bone density, osteopenia, or osteoporosis?
No, fracture is not guaranteed just because you have low bone density. Now, what's important to know too is when you're told you have osteopenia and osteoporosis, the data point that you have at that point in time is usually a bone density scan.
Mm-hmm.
The bone density scan tells you your bone density, the measure of how much bone you have. The other part of the picture is bone quality. Bone quality is how that bone is organized, the structural integrity and microarchitecture of that bone. Bone density and bone quality combine to create bone strength. So a lot of times when people get their bone density results back, they only have part of the picture. Now, if you have osteoporosis, you can still have good bone quality, and be at a lower risk of fracture. It's still important to address it, right? And not ignore it or just say, oh, I'm good with where I'm at, because we want to make sure, number one, you're not going to progress and lose more bone. But it's important to know, like, usually most people don't have all the objective information. So what tells us our bone quality? There are a couple different ways. There's an add-on software to the bone density scan, the Dexa technology, called TBS, trabecular bone score.
Okay.
This tells you what your bone quality is. Okay. Not all doctors' offices have these. They're not in every single one. You can always ask your doctor to see if they have it in their office. Some of them do, some of them don't. There's another technology called REMS, short for radio frequency echographic multispectrometry technology. There are a lot of locations in Europe at the time of this recording. There are a lot of locations in Europe, and there are only a handful of locations in the US. I think, Europe is a little more progressive in some ways, in some of those areas, and we're usually a little bit slower to adopt certain things. But in terms of this technology, tells you your bone density, your bone quality, and gives you a predictor of 5-year major osteoporotic fracture risk. So there's some super helpful tools out there that can get you more objective information. But if you only have one piece of information, if you only have your bone density right now, let's start working on making improvements from there too.
Okay. At least it's good advice to ask for the TBS or the REMS.
Yep.
When you go to see your physician, at least you would have more information, like you're saying. Yep. I think it would be hard to change your bone picture if you only have one data point, and you need others to really make a more informed choice.
Absolutely.
So given everything that you've talked about today, great information, a lot of golden nuggets in there. So what does a Stronger Bones plan look like?
If you're starting out, right, or actually not even just if you're starting out, if you know you need to do something, right, maybe you're just diagnosed, maybe you've had low bone density for a long time and you've had a recent bone density scan that showed you have had progressive bone loss. Usually the starting point is today, right? The starting point is whenever you're deciding to take action. And I know, being a caregiver, a lot of people we work with are taking care of maybe a parent or other family members or things like that. It's hard to make the decision to prioritize ourselves sometimes and to prioritize our own health. But what's important is you don't have to do everything all at once right now perfectly. All you have to do is make progress. Progress is what we aim for, because if you make progress, that's going to feed up into improvement long term. Small changes over time are going to make a big difference. So the first thing that anyone has to do is, number one, identify. You have to identify and address all those root cause contributors of bone loss and osteoporosis. Anything that's damaging your bones right now, you have to figure that out. You have to address those things. It's because we don't want to have more possibly preventable bone loss. It's a lot easier to slow and stop and prevent more bone loss than to build bone once we lose it. Both are possible. You can build bone strength at any age. It just becomes more challenging the older you get and the more bone you lose. There are fewer cells involved in the process. That process becomes less efficient. So we want to make sure we identify those things early on. That's the first part. The second part is we need to nourish the body, right? We need to restore the raw materials and nutrients that you need for stronger, healthier bones through diet, through digestion, through absorption. We have to make sure we have the right inputs to produce stronger outputs, because you can't possibly expect to rebuild something that's not there, right?
Well, exactly. You can't, like if your gut biome isn't working well, then yes, it's going to impact everything else.
And that really happens too. Getting the right nutrients happens, or the nutrients that are going to support a healthier body, healthier bones, happens on 3 levels. The first level is, are you taking in the right nutrients in the right amounts? Second level, are you actually absorbing those nutrients? If you have overt digestive issues, it's not only could they be preventing you from absorbing nutrients, it could be a source of inflammation, contributing to bone breakdown in the body too. And then the third level is, are those nutrients making it to the cell level? A lot of times, even if someone is eating healthy, they might not be hitting layer 1, getting the right nutrients in the right amounts. So that's super important, because the rest of that downstream picture is hard to get lined up. That's the second part, is nourishing the body. The third part is you have to build strength the body and strength the mind, strength the bone. You got to reduce your stress. Stress is going to contribute to bone loss, right? And I know in those caregiver situations too, a lot of times there's a lot of stress that's taking place. Maybe it's from, a parent or somebody that has cognitive decline or neurodegenerative disease or something like that they're working through. That can be really hard and be a source of stress. Then we've got our own personal health issues and things like that we're dealing with. That can be a source of stress. So we have to be able to manage that stress, right? Because that's going to be super important for our bones and for our general health. Got to improve your sleep. It is really well documented that poor sleep reduces bone quality. So if we're not sleeping well, if you're not waking up well rested, that has to be addressed. And then exercise. right? Exercise plays such an important role in your bone health.
Mm-hmm.
You gotta make sure you're doing some exercise. And you want to make sure you do the right things in a way that's going to build bone strength and prevent fracture and injury. So that's kind of a high level, if anybody starting out at any point in time, that's where you start.
Okay, so first you identify if you have a problem.
That's
Then
right.
you start nourishing it the right way. You do more work in terms of making sure all those nutrients are being utilized appropriately. And then I guess the last step is exercise and making sure that you're doing those resistant and non-resistant exercises so that you are improving your bone quality.
Yeah. Yeah.
That's quite the list to get through, but I really see the importance of it, because a caregiver would tend to look at what their loved one really needs in terms of nutrition and exercise, and then fail to really look at what they're doing.
Yeah.
Yes, and I would agree, stress and overwhelm is one of the top features of being a caregiver. So it would definitely lead to bone loss. So you make some really great points, and I think it's not selfish to focus in on ourselves so that we could better help the person we're going to care for.
Not at
Great
all.
advice.
Not at all. And it's it goes back to what I said right at the beginning of when I was talking about the steps there.
Mm-hmm.
You don't have to do, a lot of times people think, oh, I have to do it all at once, otherwise I can't do it at all. That's not how this works. Bone health, that's a long-term game, right? There are no quick fixes. There are no magic pills or anything like that that are going to resolve it the day you start it. That's just not going to happen. But if you make progress in all these little areas and you start checking, just check a box. What can you do today? Maybe it's 5 minutes making progress. Maybe it's 10 minutes. Carve out that time, because it's going to do wonders for your health and longevity, beyond just the near-term focus right now.
I think that's another golden nugget. You have to look long-term. So I can see where those small steps really do end up with a big win at the end. So it's better than having a hip fracture.
Absolutely.
Or some other debilitating break fracture that you would experience as an older adult.
Yeah.
Thank you so much. Do you have any closing thoughts for our listeners?
Oh, I would just say, no matter where you are in your health journey, or, taking care of other people who are on a health journey, be kind to yourself, be patient, be kind to yourself. Things are not always going to go perfectly. It's not like there's going to be periods of trial and error and things like that. But if you stick with it, you slowly make progress in areas, that's what's going to give you the best shot of leading a healthy, active, happy life long-term.
Thank you so much. Great wisdom. And we really appreciate all the information that you provided today, because I know that it's one thing to be a caregiver going through this process as well as the person that they're caring for. So great advice. Thank you so much for being here.
Happy to be here.
Thank you.